This podcast contains discussions on sexual misconduct. Topics such as sexual exploitation, abuse, and harassment may be discussed. Listener discretion is advised, and we encourage self-care and seeking professional support as needed.
So we continually have to remember that somebody is harmed, their communities are harmed, their families are harmed. They may be left with a child, and we were there to serve.
Assistant Secretary General Jane Connors is the first United Nations victim rights advocate. In this episode, she highlights the enduring consequences of sexual misconduct done by aid workers in the humanitarian and development sectors.
But when you use your power to exploit, you do not have the consent and the victim isn't complicit. So that's something that is very difficult for people to understand. Very frequently, it's the sort of "what were you wearing" story. Were you engaged?
She discusses the dangers of victim blaming and power imbalance. To forge a way forward, she brings innovative training methods, challenging individuals to confront their biases and behaviors.
And I think we have to use our imagination and make people feel that they're in the shoes of the victim and make people understand what their behavior is about.
This is the #NoExcuse podcast. We discuss the challenges, complexities, and potential solution in preventing and responding to sexual exploitation, abuse, and harassment in the humanitarian and development sectors. You'll hear interviews with victims and survivors, experts, aid workers, artists, and leaders. The podcast is produced by the World Health Organization's Department for the Prevention and Response to Sexual Misconduct. I am Guni Dias, your host and Global PRS Network Coordinator for the department. Welcome, Jane Connors, to the #NoExcuse podcast.
Thank you so much, and I hope all is well with you.
It's so great to have you on this podcast. You provide a very unique perspective to the topic of sexual misconduct done by aid workers in the humanitarian and development sectors as the UN's victims' rights advocate. Your background and experience is quite extensive and impressive. What brought you to take up this role as a victims' rights advocate in the United Nations?
I worked really all of my life on issues relating to sexual violence and gender-based violence generally, and also violence against children. I have a significant human rights background, and it was interesting for me because this is not an area that is looked at through a human rights lens. It tends to be looked at through a conduct and discipline lens, and the people who are affected are forgotten. So I applied for the job. At that time, I was working for Amnesty International as their international advocacy person. So I had a bit of advocacy background. I was surprised and very privileged to be able to be successful. I have to say I didn't think it would be as difficult as it has been. It's not been a very easy ride, basically because people's attention moves off the situation of the victims very quickly, and they get caught up in excitement such as investigations, such as accountability through legal frameworks and things of that nature. I am a trained lawyer, and all I can say is to certain questions, law is not the answer.
How can we better serve as we lose sight of the victim or the survivor? How can we better serve the needs of victims and survivors?
I think we need to believe them, we need to respect them, and we need to listen to them. So these are three things that don't happen so much. When they complain, they're not necessarily listened to, but that is not uncommon with regard to sexual misconduct generally. Frequently we have discussions of their complicity, perhaps, their consent, and I say when you're using your power to exploit, and it's exploitation generally, I think people understand abuse a little bit more, but when you use your power to exploit, you do not have the consent and the victim isn't complicit. So that's something that is very difficult for people to understand. Very frequently, it's the sort of "what were you wearing" story. Were you engaged, for example, in transactional sex? So it becomes less problematic in terms of what the victim is experiencing. And we have to be aware that the people who are exploited are in extraordinarily vulnerable situations. They are very poor. They have no access to goods, public goods, and they're often they're very, very marginalized. So that's a very big issue. Sort of believe, respect, and don't blame.
And what are some of the things as in your work of advocacy, going to different countries, meeting victims, what is something that you have to keep on telling to members of the workforce in agencies?
Believe people, believe what they say. And we have all of these, what do they call them, scandals? They're not scandals. We've got another example of entrenched gender bias, stereotypical behavior, and so on. But we have these things pop up all the time, and there will have been reporting. There will have been indications of what's going on, but people mightn't necessarily be believed. So we continually have to remember that somebody is harmed, their communities are harmed, their families are harmed, they may be left with a child, and we were there to serve. Our organisations are organisations based on principle that these issues occur generally, that there's women and girls, boys and men fall victim to sexual misconduct. That is an issue, that is certainly the case, but in our organisations, that should not occur.
And you wrote early this year, if I'm not mistaken, the victims' right statement.
It took me 4 years to get it agreed. So we had a version which we produced in about late 2019, and it was discussed across the system from that period on. And it took a while because what we're looking at, it was easier to come to grips. I did a set of principles on a victim-centered approach to sexual harassment, and victims of sexual harassment are typically UN personnel as well. What we're talking about when we're talking of sexual exploitation and abuse is usually, but not always, people who are not employed by the United Nations. So there was a bit of concern in terms of raising the expectations of victims, and there was a lot of discussion, and ultimately there was an agreement after, as I say, about, I suppose, 3.5 years, 4 years of discussion.
Wow. It's unfortunately it takes so much of time to get something out in the international sector. But for this work to change, for us to be more victim and survivor centered, we need to rely on people such as people on the field. We need leadership. We need really the entire organization to come together. And some of the things that we've observed is that men sometimes don't feel like they're part of the solution, or they don't feel that this problem relates to them. What do you have to say about that?
Well, certainly when you look at those who are involved in addressing these issues, they are predominantly women. Probably a bit more participation of men in the context of uniformed personnel, because they can perceive that certain things can be done, which are a little bit, I think, external to the problem, because fencing, lighting, things of that nature is relevant, but it mightn't make much of a difference. It might make some difference, but essentially we've got to get at the root of things. I have to say that the way we discuss these issues is not conducive to people taking account of their responsibilities. And I was very lucky last week to be involved in a very interesting Swiss theatre production, the Forum Theatre, that they brought to New York. And hopefully, because I've introduced them to Gaia in WHO, may be able to benefit from this. This was extremely interesting because they do scenarios with interactive theatre, and that really brings out the reality. And one of the performances was held in the presence of the President of the General Assembly, who is a man. He was extremely supportive. A number of gender champions, a number of ambassadors were very supportive. And I think they're the sorts of, we have to use our imagination and make people feel that they're in the shoes of the victim and make people understand what their behavior is about. So I think because our usual training is, delivering thou shalt not, and there is not thou shalt not why, what is the effect? So twisting it around. And I would love to see many more men involved. I did have at one point a male staff member, and I did have at one point a male intern, but I haven't got a male staff member or a male intern anymore. But this is not uncommon in gender-based violence. You have a significant proportion of women who are involved in it. And you look at, for example, the example of Dr. Tedros. He's been very active. He's shown his leadership. And that, I'm sure, has a significant effect on the staff in the World Health Organization. So a lot more stepping up, a lot more indicating that it is a responsibility, and you have an obligation to live up to your organization's principles.
Another thing that we hear a lot from the workforce is that as we increasingly report cases, that people will start reporting maliciously. What are your thoughts on this?
Yes, I hear a lot of that as well. And there is a very interesting quote from an author which goes along the lines of fabricated reports, like airline crashes, are rare but attract the imagination. So I think the difficulties in reporting, what people go through if they do report, does mean that we have underreporting. And yes, I'm sure there are fabricated reports from time to time. But research does indicate that the likelihood of those reports in sexual misconduct cases generally is pretty low. And we don't spend our time, I suppose, agonizing about fabricated reports of theft.
When people assume that people report maliciously, I think they completely overlook the emotional burden it takes to come forward, and that despite their fear of retaliation. Any other hurdles that victims face as they consider coming forward?
And in the process, within our organizations, the accountability is limited to administrative and disciplinary measures. And to get to those administrative and disciplinary measures, you need to have an investigation. The level of proof, clear and convincing for some, beyond all reasonable doubt for others. That's significant. Enormous stress on the due process rights of the alleged offender. The victim also has due process rights, by the way. And I'm not undermining in any way, shape or form the due process rights emphasis. And then after that, it goes to the Office of Human Resources. Then after that, there are possibilities of appeals, not only if the offender can appeal, and then if the offender is unsuccessful, they can appeal and then appeal again. So I think there's a long way to go, and then it's a long time. And what do you get? And we're not even getting into national criminal accountability, which is extremely difficult. And the acts will have occurred some time ago. Again, you will want to move on with your life. You won't necessarily want to, and you will be, we all know what happens to people in national context, which is more or less the same in the administrative context.
Yeah. WHO's policy states the duty to report, where staff and collaborators all have an obligation to report acts of sexual misconduct to the WHO investigation department. We've noticed some of the workforce members struggling with this concept. How do you recommend to address the challenges associated with mandatory reporting?
There are issues which have to be weighed up. The interests, and importantly, the safety of the victim, and the interests of the organization in not having a person who's offended on their staff, and also protecting their reputation. So these are, and I'm not underrating the importance of reputation because it goes to operational effectiveness. So if you can't have trust in an organization, there's no operational effectiveness. So they're the things that have to be weighed up. And I think, yes, mandatory reporting, yes, that is the obligation of a staff member, but there can be situations, and I think people know this, where it can be life-threatening. It will depend on the context. So these things, and I don't think anyone who's addressing these issues, who addresses them in a sincere way, underrates what you're weighing up. And the best approach will be to speak with highly trained investigators. Hopefully you have those. And now I know you have people with backgrounds in sexual who know about investigations into sexual misconduct, know about the context of the situation, and are able to address that appropriately. But it's not an easy call. Yeah, it's definitely not an easy call, and we know about it from domestic systems that introduced mandatory reporting for violence against women, violence against children, that these issues are not simple. So in no way, shape or form am I underrating the issues that you're weighing up.
WHO's current strategy is highly influenced and inspired by you. What's your advice to WHO as you've seen us evolve? What is your advice?
Well, you've evolved very quickly, and I think that that's really a credit to you. And the last thing I advised was perhaps you would like to look at the idea of having a victims care specialist, and I see you've advertised for that position. So I think evolution is ongoing. I don't have any sort of you've missed this out type of advice, but just continue going forward in the way you're going forward, and certainly be as I'd like to hear more rights than centered, but that's just me. But I think in terms of, and it's not only inspired by me, you've got some very inspirational people working with you, and certainly directed by your head. So that's important. I mean, leadership is enormously important. And to get that entrenched in every manager, because everybody is accountable, is really important. But I think you move on as you're doing and continue to expand the conversation. And it's, for me, I think interesting that you've also used these creative methodologies to bring the issues to bear, such as the What Were You Wearing exhibition, which I was very happy to see was brought to WHO, and hopefully you'll be able to move forward with the Forum Theatre company. And it takes effort all the time. And in that effort, make sure there's a continued focus upon the fact that there's a person who's the center of the behavior you're looking at.
I really like this idea of theater and improv. It has the ability to push individuals beyond their comfort zones, and it pushes them to immerse themselves in lives of others that they may never have thought they could relate to, and being faced by their own biases and behaviors. As we navigate the ongoing work of preventing and responding to sexual misconduct, what key messages or insights would you like people to carry with them in their hearts?
People are very keen to say this is always going to happen, this behavior. I don't like hearing people say that. This behavior is not inevitable, but it's expectable given the situation people find themselves in. And the situation of vulnerability will be different between staff and persons who are beneficiaries, those outside the organisation. So I think it's definitely preventable. So that's another thing. The other thing I think you need to keep reminding yourself is that people who fall victim to these misconducts are not weak. I hate hearing it when people say their lives are shattered, this is never going, they'll never recover, and so on. They are people, extremely determined, extremely keen to get on with their own lives. So remember the strength, but don't impose an obligation on the victim because of their strength. And at the same time, do as much as you can. They're taking account of the effects this sort of behavior has on individuals, their families, communities, and your organization. It will take a long time, but get us to a level of preventability.
And to end on a hopeful note, what keeps you hopeful in this work?
What keeps me hopeful? Well, all of this takes a long time, and I think just the people you can engage. And I never thought I'd be able to engage with the internal justice system. They're very keen to hear more. I have regular contact with the judges, and that's just something because, when you get to a level of who are you able to talk with, who are you able to maybe influence, well, not influence, maybe get them to think a different way or, take on board certain things. There are hard areas to get to, and this is one of the harder areas. I think another area which is difficult are the investigators. So to get them to, and a lot has gone on at the national level to change investigative processes, because no investigation will be successful in terms of a result unless the rights and dignity of the victim is upheld, because that's your witness. And if that isn't the case, you're not going to get anything. Well, that's what's been shown through a really interesting study over a number of years, a joint study of academics and police forces in the UK, Operation Soteria Bluestone, that if you don't centre the rights and dignity of victims, your investigation will go forward well, and your accountability process therefore will fail.
Thank you, Jane, for providing guidance on what lies ahead and where our focus should be with a victim and survivor-centered approach. Thank you so much for taking the time to speak to us.
Not a problem, and enjoy the rest of your day.
Thank you for listening to this episode of the World Health Organization's #NoExcuse podcast. We hope we've given you another perspective on preventing and responding to sexual misconduct in the humanitarian and development sectors. We release new episodes every 2 weeks. But if you have any feedback, questions, or suggestions in the meantime, feel free to reach out at prseah@who.int. Until the next time, goodbye.